Welcome to the Heartlands Award Forum meeting. This is the first, the virtual forum meeting we're having, and considering what's happening globally with COVID-19, so we thought it was appropriate to have a briefing just on a single item, just on the COVID-19, how it's affected people, and obviously, we're very hopeful that with the vaccination. Slowly we are coming out of the lockdown measures, so hopefully we hope to get back to normal as possible in the near future. Just to remind people, the residents listening to this meeting, that this meeting will be online. Recording will be available, so if anyone wishes to see at any stage, they can do so. And we really, first I need to say a huge thank you to Beverly Edmead for arranging this, and really grateful for Dino, who's actually, decided to actually join us and give an update. So yeah, really grateful for you, taking your time out and joining us. And Dino, over to yourself.
Thank you, Councillor. I am Dr. Motti. I'm a public health registrar within the public health team of Birmingham City Council, and I'm here to update on the COVID situation in Birmingham and in the world. We have passed recently the first year anniversary of the first case of COVID in Birmingham, and we have seen ups and downs, and we've all participated in this collective effort to contain the virus through lockdown, social isolation, and infection control measures that we've all followed together. And we're starting to see the results. And now, alongside the vaccination, we hopefully are in the final stretch of this pandemic for our communities. The 7-day case rate in the last period between the 6th and the 12th of March is of 75 cases per 100,000 population, which compares to 88.5 per 100,000 population in the previous 7-day period. And this represents a 15% decrease in number of cases. That is in line with what is happening across the West Midlands, more or less. I mean, Birmingham is the largest population, obviously, so we might see some differences in smaller groups. The hospital admissions have been between 15 and 23 new cases a day at UHB over the last 7 days, and we will see that these numbers will drop, but it will take a bit longer than the actual cases. There is a little bit of delay in all infectious diseases, and with COVID, we've seen that it follows a bit slower. The decline that we see now in cases will follow in a decline in admissions, so in severe cases, which will then also result in a decline in mortality in the hospital deaths. We see that the spread at the moment is primarily occurring through households and social and workplace interactions, which means, again, that it's very important to maintain our social distancing, hands, face, and space, washing our hands, don't touching our faces, and wearing a mask, keeping distance, 2-meter distance, and try to continue to observe those measures that have become second nature for all of us, but which have proven so effective in this latest lockdown. In terms of Birmingham across the country is doing pretty well, I would say. It's the, let me just check exactly so I can tell you, it is the 36th, sorry, for the city of Birmingham is the 48th highest in England, which is compared to other upper tier local authorities. In terms instead of Heartlands ward, and this is why we're here tonight talking about the ward specifically, it ranks 36th out of 69 wards for the number of COVID-19 cases, and this is meant where the first is the highest and 69th the lowest, and we have 12 reported cases. And it has instead a rate of 89.61 COVID-19 cases per 100,000 population, which compares to the average of Birmingham of 75 per 100,000 population. This again ranks the ward 18th out of 69 in terms of rate of infection. We can do a lot as a community, and Birmingham has put in place a program called COVID Champions, which can help with spreading accurate information, up-to-date information. You can join. The Heartlands ward has only 6 COVID champions, which is a good number, but it could be much more in proportion to the population. By joining, you can have access to first-hand information, very up-to-date information, join training programs and updates organized by the public health team, which can give you the opportunity to have access to accurate information, which you can share with your family, with your community, with your neighbors. And this is of paramount importance in a pandemic where we've seen a parallel pandemic, an infodemic around false information and myths. And this inaccurate information can have profound effects in the way that communities behave in the face of infections like COVID. So it's a real civic duty and important role that you can play in controlling the spread in your community and making sure that the right informations are shared across the community. So you could join the COVID champions and you could really make a difference. Another thing that is important to know is the differences between tests. So there are some tests being sold online privately that test your immunity. These tests are not something that public health would recommend because the immunity is not permanent, and it also doesn't tell you much about whether you've infected, if you even have antibodies. It can only tell you something about the past and in a very narrow window. So they're not used beyond research at the moment. We have instead 2 other tests which can tell you whether you are indeed having a COVID infection, and these are tests tailored for people with symptoms. And in this case, it's called the PCR test, which you can book online through the 111 or calling the 111 number. And this test is very accurate, very sensitive, and it's very good at telling you whether you have the infection. For people instead with no symptoms that want to maintain a level of, let's say, confidence about not being one of the asymptomatic carriers of the virus, maybe when they have caring responsibility for some elderly relatives, the council has also put in place a service called rapid testing or lateral flow testing, or you will see it referred to LFT, which is a very similar process but much faster. It doesn't require the intervention of a laboratory technician, and they can tell you the result within 30 minutes. It is a test which is maybe a little bit less sensitive, but which has the ability to tell you whether you are in the infectious phase, whether you have a lot of the virus in your nostrils or your throat, and which can give you instead a good level of confidence, or an increased level of confidence that you can carry on your responsibility and you can go visit your elderly to help them in your caring duties. With regards again to Heartlands as a ward, the spread of ages where we see the majority of cases is about 30% in the 0 to 19 year group, which is a little bit higher, quite a bit higher than the average in Birmingham. Then we see 35% of cases concentrating in the 20 to 39 years group, which is slightly lower than the Birmingham average. And we see another 30% in the 40 to 59 year group, which is again roughly the same as for the Birmingham average. The other, let's say, success story of this last month has been the vaccination campaign, which the NHS has carried forward so rapidly compared to other European countries, where we see that we are achieving the vaccination of the most vulnerable and the elderly, which are again, according to the rationale for this vaccination, the main priority of these early stages of vaccination, because we are not as yet aiming to achieve herd immunity, but we are aiming to achieve a reduction in those severe outcomes in hospital and deaths, which are both very tragic but also very dangerous for the stability and resilience of the NHS. So we see that in Birmingham as a whole, we have vaccinated 88% of those 80 years of age or older, 90% of those older than 75, and 88% of those older than 70. These numbers are a little bit lower in Heartlands, so I would recommend to all of the residents to respond to the calls and emails that you're receiving from your GP and come forward and get vaccinated, because the vaccine is very effective, very safe, and can really make a difference, especially for those in the older age groups, which are being called at this stage, which are a much higher risk of infection. But now they're moving to vaccinate also in other age groups, and it's as important in those age groups as in the rest, because obviously there is the risk of spreading, and if you want to be, let's say, more confident of controlling the virus, especially for your elderly relatives and others in the community, you should take up the vaccine, which has been shown to be very effective, not just as reducing the severe health effects of this COVID virus, but also at reducing the spread of the virus between people. And those numbers are going up. We noticed though that in Heartlands ward, the rates are a little bit lower than the rest of Birmingham, and so that it's important to highlight this to make sure that the community is aware. Otherwise, I'm very happy to take any questions, and I am available.
Thank you, Dr. Mosi, for this. That was very useful. Unfortunately, we don't have many residents actually logged in, but just like obviously the vaccine is being rolled out, and I think it's very important. I think a lot of people are getting this. Obviously, before there was like perceptions in certain communities, but I think people are overcoming that, and they want to get vaccinated. And I think in the last couple of days, people, some people I've been speaking to, they're a bit concerned about AstraZeneca because all the hype in the media that, whether it's safe or not. I think, that's one thing. So, and another, I was asked a question by someone who had, first dose of Pfizer vaccine back in January, and they were asking if when they're actually called for the second one, will they get, obviously it will be a second dose of Pfizer, or will it be AstraZeneca? And obviously I didn't know the answer for that. So yeah, these are the kind of, one or two basic questions I had. So
absolutely. And I'm very up to date with the AstraZeneca, on the AstraZeneca front, because I just watched tonight the press conference of the European Medicines Agency that reported on the review that they conducted in the last 2 days for the very rare events of thromboembolisms and clots that have been reported across Europe. And they have concluded that the rate of these events is overall lower than expected as baseline for clotting events, and that in any case the vaccine is effective and safe. And for example, some European countries have already decided to restart vaccination with AstraZeneca. It is a natural process, I think, that of maintaining a very close eye on any new medicine, and it's only good that our agencies are able to access this data very rapidly and make sure that any very rare event, and we're talking about one event in 1 million or even one event in 10 millions in some of these cases, is made like the subject of scrutiny, and we make sure that all the information available on the medication leaflet is there so that a clinician can expect and react very quickly if one of these very rare events, which might have nothing to do with the vaccine itself, to occur, and that is the role of the international and national medicines agencies. So I watched the press conference and I was reassured that everything was done to identify any causal correlation, which at the moment doesn't seem to exist. Your second question was about whether the second dose would be provided of the same vaccine or another. Am I right? And at the moment, I believe that the indication is that one should be given the same kind of vaccine, but that there is some work being done at scientific level to ascertain whether there is a possibility of giving a different vaccine and whether this can confer better immunity than the same. I haven't yet, as of yet, seen the results of these efforts, but I would assume, given that all vaccines at the moment are deemed effective and safe, that one should sort of be confident to take the vaccine that they've been offered. I've had relatives of mine who had the Pfizer vaccine, the AstraZeneca vaccine, absolutely safely, and they were offered that one, and they were happy to take it because it's such a liberation, I think, after a year of constant pressure and limitations to finally do our bit to on the road to normality. And we've seen that the government has put in place a range of initiatives already to start relaxing the lockdown measures, and they have used an approach which is much more cautious, which allows time for the effect to emerge in the data and for that data to be analyzed for the effect of the new measures, and if any correctives, be able to identify which part of that measure has determined an effect in the COVID rates. So we've seen already the reopening of schools with some sort of approaches for rapid testing. We've seen the ability now to meet outdoors with one person, and there is a roadmap which 5 weeks by 5 weeks should determine return to a more, let's say, socialized existence. But I think it's that after we've seen in the what happens by relaxing too quickly, that we do it step by step. In terms of confidence in the community, the data is still very positive. We see still 80% of all the 75 plus in Heartlands having taken up the vaccine. Is actually almost 81%, which is a very good number. That doesn't mean that we have to sort of sit on our laurels. There is still a 19% that should be vaccinated, and I think our GPs are doing all they can to make sure that they are aware of this possibility and they're offered a vaccine. And I think COVID champions can do a lot in this. COVID champions themselves, once they're vaccinated, they can tell to other members of their community of their experience, and that it was safe, that they had maybe some very minor side effects, like all vaccinations. We've all had the flu vaccine and sometimes had a little bit of soreness in the arm or the muscle. We felt a little bit tired for a day or two, but otherwise, I've heard of all sort of success stories around this, and I think COVID champions are able to convey this message very effectively, being embedded in the community. I'm sorry, Councillor, did I answer to all of your questions?
Yes, Dr. Moss, you have. So yeah, thank you for that. That's been very useful. It's just that unfortunately we don't have any more residents who have logged on, but we're really grateful for you taking your time out. So over to yourself, Beverly. Is there anything else we can?
I've said all I have in terms of local data. As usual, I'm always available for any question you may send to me by email or may come later from any members of the community. You can send them to me or to any of my consultant colleagues in the public health team.
Yeah, that's very useful. Thank you for that. Thank you, Dr. Mosley. Really appreciate you taking your time out and giving us this presentation. We're also really grateful for Beverly Edmead for arranging this meeting, and also Pat White, who's doing it at the meeting. She's always been very supportive of all the World Forum. So thank you for that.
Councillor,
Thank you.
sorry, Councillor Shah, can I just ask Dina a question? Dina, can you pop some information in the chat box, all the links that we need, so at least then that way we can share those as well with residents. Relevant links for COVID champions and things like that. If you don't mind putting that in the chat box, we could get that information out as well.
Absolutely. Let me just paste it in the chat box.
Thank you very much. Thank you. While Dina's doing that, Councillor Shah, is there anything else that you want to?
No, that's it. That's it, really. Thank you. I think we're done.
Yeah, we'll do. Wait for Dina to finish with the chat box, and then.
Thank you. I've pasted it in the chat box, so you can have a look.
Yes, I can see that. That's brilliant. Thank you. So if any of the residents basically do decide to watch the meeting online, at least they'll be able to access this information, which is very useful.
Thank you very much.
Thank you, Dr. Dina Murthy, and thank you, Beverly Edmead. Thank you, Pat, for arranging this. It's been a short meeting, but it's been very useful.
I think it will be the first of many, I'm sure. So I wish everybody a good evening then.
And you.
And thank you for having me. It's been a privilege.
Thank you, Dr. Murthy. Thank you. Really appreciate it.
Bye-bye. Bye.
Bye. Thank you. Bye. Bye all.
Councillor Shah, is there anything else you want to add before I stop the recording?
No, not really. I think this meeting was just like a single item, and to cover the ongoing issues with COVID-19. And I think we had a really good presentation from Dr. Dina Murthy, and obviously it's also shared the links in the chat box. So thank you, Beverly. Thank you for arranging it.
Thanks, Councillor Shah.
Thank you. Bye. Good evening. Good night.